Hi everybody and welcome back to my channel. Today we'll be talking about a very interesting condition called sarcoidosis. Sarcoidosis is a multi-system problem, meaning it can affect lots of different parts of the body, including the eye. So if you'd like to learn more about how it can affect the eye, please do stay tuned. So let's jump straight into this video. Sarcoidosis can affect the eye in a multitude of ways. The most common way tends to be inflammation in the front part of the eye, which is called iritis or uveitis. You can learn more about this in my uveitis video. Sarcoidosis can also affect the middle and back of the eyes, called intermediate uveitis and posterior uveitis. The exact cause of sarcoidosis remains unknown, and in terms of its manifestations, we tend to treat the features that are present usually with steroids or immune modulating therapy. In terms of the iritis or uveitis that can be caused at the back of the eye due to sarcoidosis, this can manifest itself in the form of blockage of blood vessels, i.e. occlusion, fluid at the back of the eye, i.e. cystoid macular edema. You can then also get deposits of inflammation, which are known as snowballs and snow banking. Patients with sarcoidosis can also then go on to develop complications such as glaucoma, cataracts, and bleeding spots in the back of the eyes, known as neovascular membranes. In terms of the ways in which it can affect the body, the common systems that affect it include the chest, i.e. the respiratory system, and the heart, the cardiovascular system. In terms of the respiratory system, patients can have a dry cough and shortness of breath, and this has very characteristic features on chest x-ray and CT scans. In terms of the cardiovascular system, patients can complain of chest pain due to issues such as pericarditis. In terms of the skin, patients can develop these red lesions on their skin, which is called erythema nodosum. Patients can also then develop swollen joints. They can develop problems with the nerves which control certain muscles of the eyes, and they can also develop swelling of certain glands such as the parotid gland in the side of the cheek. In terms of investigating this condition, a blood test that can be carried out and requested is a ACE blood test. But bear in mind that the ACE blood test can also be found to be high in other conditions. Patients will in the first instance usually have a chest x-ray, and this may then lead on to more sophisticated ways and methods of imaging the chest, such as a high resolution CT scan to look for changes such as pulmonary fibrosis. Occasionally, if patients develop swelling in certain glands such as the lacrimal gland, which produces tears, then this can be biopsied to confirm the diagnosis. As mentioned earlier, the mainstay of treatment tends to be treating the features that are present. So if iritis is present, then you treat the inflammation. If cataracts develop as a complication, then cataract surgery may be offered. If glaucoma develops, then pressure lowering drops will need to be initiated. Thank you so much for watching this short video about sarcoidosis. I hope you've learned about what sarcoidosis is, how it can manifest in the eye, and how it can be treated. Please do click the like button, the share button, the subscribe button, and please do comment below about whether you have sarcoidosis yourself or you know anybody else that does. Until next time, take care. Thank you for watching.